Hello everyone, welcome to my channel Study Nursing by Sense Goals. Today we'll be discussing about a nursing care plan or nursing process. I hope by the end of the video you'll be able to understand in detail what is a nursing process, what are the steps involved, and how as a student nurse or a nurse starting your career or even as to a nurse practicing your career can take care of a patient with confidence. So, without much ado, I'll go towards the upcoming slide, which is a definition. So, as per nursing North American Nursing Diagnosis Association, that is NANDA. As per NANDA's definition, a nursing process is a five-step or five-part systematic decision-making method focusing on identifying and treating responses of individuals and groups to actual or potential alteration in health. I know the definition is a bit long, but I'll break it down for you with some keywords so that it's easy for you to remember. The first keyword I would like to project here is it is a five step or five part systematic process. It has got certain step by step process. And the second keyword is identifying. And the third is treating. And the fourth is obviously the whom we are doing the care for, which is it might be patient or a community or family. So the definition is broken down into a couple of keywords. The first is it's a five-step process. Second is where you're identifying the problem. Third is where you're treating it, and fourth is whom the care is delivered. So I hope now when you read the definition, it makes much difference to you. So it is a process of five-part systematic decision-making method focused on identifying and treating responses of individuals and groups to actual or potential alteration of health. So that being said, let's move on to the five step of nursing process. So the steps are aligned in add by format, which is easier for you to remember. So that comprises of assessment, diagnosis, planning, implementation, and evaluation. In the further slides, I will take you to each step in detail. But let me know in the comments if my speed is, above what you can understand, or if it is all right for you to understand. Yes. Let's move on to the first process, which is assessment. So, assessment in the nursing process is the first step where you are collecting a couple of data. When I say it's a process of data collection, there are two processes involved in it. First is the subjective data, and the second is objective data. Then, when we say about subject, it is oriented to the patient, what patient tells you. And objective is where you are observing in a patient. An example of subjective data is where the patient tells you, I have severe pain over my neck or on my neck for 2 days. An objective data example is where you are observing that the patient has grimaces, facial grimace, that the patient is in severe pain, or you take the observation and you find out that he or she has higher heart rate, the BP is elevated, etc. So that's called as a objective data, and subjective data is what the patient tells you. So I hope you have understood what is the first phase. It is the assessment. It's a first step. It involves two steps. One is what the patient says, and another is what you are observing. You can inspect the patient. You can observe the patient, auscultate, palpate, record, monitor, do all of those things in the first step. All right. I hope you have understood that. And moving on to the second one. So once you have collected those data, then it is time for you to diagnose. So it is similar to what the medical diagnosis are. It is much different, but I would say for the ease of understanding. So imagine the doctors, they go collect the data, they also listen to the patients, they also look at several lab values and everything, and then they come to a conclusion similar to the psychologist or the clinical psychiatrist. What they do is they do the mental diagnosis, right? So likewise, we nurses will also formulate a diagnosis, And the definition goes by a clinical judgment about responses to actual or potential health problem on the part of the patient, family, or community. Or I would break it down for you as it is the actual or potential problem which you identify in the patient. So that's what is called as a nursing diagnosis. An example for nursing diagnosis is acute pain related to the disease condition or chronic pain related to the disease condition. This is not a proper diagnosis, but just for the ease of understanding, I was explaining to you. Yes. And let's go to the next phase, which is a planning phase. Planning phase is the phase in which you plan and design all those interventions. So what interventions you're going to do depends on a thorough assessment and a proper diagnosis for the patient. So imagine you plan for a wedding and you plan a couple of things, for example your makeup, travel, getting your family ready, etc. So likewise in the nursing care plan, based on what the problems the patient is facing, you would formulate certain steps that is coming under planning. I would tell you, when you were planning your when you're doing the planning, you should make sure certain things in mind. For instance, we use a smart synonym in the goal making process. An example of planning is: by the end of my shift, my patient has reduced pain, as evidenced by improvised pain scale or improvised observation. So this is an example of smart goal. So what do you mean by smart goal? When you generate or when you design a nursing care plan, it's important that it's not quite general. For instance, when you say my patient has reduced pain, so it is very general. You don't know by when the patient's gonna improve in condition, and how do you know it, and how effective is it. So nothing is there in that general statement. Instead, when you make the goal specific, that is, by the end of my shift, my patient has reduced pain, and it should be measurable as evidenced by an improved pain scale or improved vital signs. And the next step is attainable. It should be attainable. When a patient, for instance, has chronic pain and he or she has got cancer, then when you write my patient has no pain at the end of a shift, it's not attainable, right? So it should be a realistic one. That's the next point. And it is time oriented as well, that is towards the end of your shift. Or another example is when you work in as a recovery nurse and you pay and the patient is brought from the theater and is on active anesthesia. So for the first or the second hours as a time frame, you would say my patient has risk of aspiration and remains safe during the first or second hour, right? So that is an example of time oriented goal. So likewise, what I was saying, the goal which we design should be smart goal, which is specific, measurable, attainable, realistic, and time frame. This is how you will plan your nursing planning in nursing process. And the fourth step is the implementation process. In the implementation process, it's a synonym of action plan, right? So you would provide a couple of interventions that you design. In the subsequent videos, I plan to make several nursing care plan, but do let me know in the comments what are the several nursing plans that you are looking forward for. Which is the most toughest one? Which is the one that you find most difficult to implement? So let me know so that I can help you with those in the future videos. That being said, let's come back to the implementation process. It is an action plan where you design several nursing care, like positioning or helping the patient with the nutrition, or administering the pain medication as per the order. So all of these comes under the implementation phase in the nursing process. And the final stage is the evaluation. It is the final or the last stage, yet it's most important. It could be positive or negative based on several factors. So do not think that only the nursing intervention determines the comfort or the safety of the patient. No. So the patient, when he or she is hospitalized, has complex things going on. First of all, with their human body being complex. Secondly, the period of hospitalization, the environment, socioeconomic factors, the family factors, all of them affect them. So when you do the intervention and when you evaluate whether it's successful or not, you need to also consider the factors that are underneath or underlying, which could lead to not achieving those plans. For instance, when the patient has a chronic pain and you intervene a couple of things, but at the end of the shift the patient still has the pain, which is really understood, which is otherwise observable in any of the patient who has a chronic pain, right? So that being said, in the evaluation process, you evaluate whether the nursing steps that you did were successful or not, because based on that you will consider redesigning the nursing care plan or escalating to the your reporting authorities, or taking the further step. But at the same time, it's also important that you reassess or reevaluate. For instance, you have a patient with acute pain, you have provided a couple of interventions, you evaluated it and found out that the patient has much comfortable status now. It doesn't mean that you're not going to look after the patient or reassess or recheck on the patient. It's never like that. You go and reevaluate. It's important that you do it. Yes. So with that, all the five steps are over. So we'll have a quick look at what are the nursing processes that we discussed. So we began by nursing process definition by Nanda, where I introduced to you a couple of key points that includes, what were those? That included whether you are identifying the problem, whether you're treating the problem. That's a five-step process, and you're providing this care to the patient, and those things should be either actual or potential problem. So this that was a meaning of diagnosis. Then we spoke about assessment, the first step, which has subjective and objective data. Diagnosis, which is the problem statement that could be actual or potential. And the third one in the planning, where you plan your goals in a smart way. And implementation process, where you're implementing or putting into action all those plans that you have made. Evaluation, checking whether it was a positive outcome or a negative outcome or no outcome achieved. So these are the five processes. I hope you understood the process in detail. By understanding this, or by forming a basic, the strong base in the nursing process would help you to work better as a nurse, whether you are a student nurse providing care, or whether you're a practicing nurse, whether you're a nurse who is about to start your career, or whether you're an individual who wish to go into a nursing career. So I hope you got some idea about the nursing process. If you liked the video, please consider subscribing to the channel. Thereby you can enhance your knowledge, learn day by day, and feel confident in providing the patient care. With that, I wish you good luck with your studies, with your career. Stay tuned for further videos. Thank you so much for your time.